Good morning, everyone. How are you? Happy Sunday. So, I wanted to come on and talk about COVID-19. Um, if you have been like me, you have been immersed in the media and, reading and following, this virus. And for me, as an empath, I am feeling the fear and the sheer panic in the universe right now. And I'm absorbing that energy, and it's incredibly overwhelming. And I think that I have a social responsibility to try and I think as all healthcare providers on social media, that we have a social responsibility to try and explain this situation in the best way possible so that people are getting accurate information. For me as a healthcare provider, I know where to access that good information from, right? And even then, depending on the sources, that information can be very confusing, and it has been confusing for me at times. And so for you at home, it must be incredibly confusing because, there's a lot of misleading information out there. That's just media coverage, right? And so, I really want to talk about the COVID virus and, why in one breath we are saying, the virus is not that bad, and that people are going to be able to manage it really well. And in the next breath, we are shutting down schools and social events and doing that because, and I think for some people, if they don't really understand why we're doing things, it increases that confusion. It also increases the thought of, well, it's not going to affect me. This pandemic is really forcing the world right now to get out of the me-centered state, right? Because the things that we are doing is for the good of everybody and the collective. And we have to stop thinking about just ourselves and whether our immune system or our daughter or our son or family are going to be able to do this. And we need to have social responsibility. So when we think about COVID, the reason why this is a bit different is that, when this first started, I was thinking about, how is this the same or different than kind of the other pandemics that we've had, things like H1N1 or SARS. I graduated nursing school during SARS, and this is different. First of all, we've learned a lot from SARS. SARS taught us a lot, and we are really incredibly lucky for that knowledge. And so we are very lucky in Canada to have a very proactive pandemic planning. The fact that we have a universal healthcare system, the fact that we have water and sanitation in most parts of Canada. These are things that are, incredibly important as foundation to prevent the spread of pandemics, right? Like when we think back to the Spanish flu in 1918, I mean, a healthcare system wasn't necessarily in place. Water and sanitation at that time was very different, right? So when we think about the COVID-19 virus, we can't compare it to previous flus that spread rapidly, because with flus we had immunizations, even though the immunizations for flu on those years weren't necessarily 100% effective for that strain. It did provide some help and immunity and protection. We also were able to lean into antivirals. And antivirals were available to help to decrease the length of illness or the severity, especially in high-risk people. With COVID, we do not have that. With COVID, we so first I want to premise that the information that I'm giving you is based on my best interpretation of what is out there. That information is changing rapidly all the time, and so I am doing my best to provide the most accurate information possible, but there may be error to what I'm saying, okay? But what I've read is that we're quite certain that about 30%, 30 to 70% of the population will end up with COVID. Most of us will have a very mild illness, handle it very well, and move on with our lives. 10% of the people that do get sick will need hospitalization. So with COVID, the concern is the illness lasts longer than the regular flu. For those people that are at high risk, so people over the age of 60, people who have cardiovascular disease, diabetes, or any severe lung disease, they're at the highest risk. They will need respiratory support. And what does that mean? Respiratory support means that they will need oxygen, or we will need to put them in an intensive care unit, so a high-level bed in a hospital, and we may need to put them on a machine to breathe for them. When we think about the capacity of our hospitals, when we think about how many beds we have across Canada, when we think about the number of beds we have that have the capacity, a high-level capacity to be able to have what we call ventilators, so machines that breathe for you, we have a very small amount of those beds. In what I've read, there's probably less than 4,000 across Canada. Our hospitals in Canada are already at 100% capacity. So our ICUs are, without a pandemic, are running at 100% capacity. So the fear is that our healthcare system is going to collapse. Not that people in general are not going to be able to fight off this virus. It's that the people that are really, really sick are not going to have access to the care that they need, and we're going to have to refuse them because we do not have a ventilator, which means that people may die unnecessarily. And so what do we do to prevent that from happening? This is where the social responsibility comes in that we do self-isolation, social distancing, the hand washing, the, coughing into our sleeve, staying home when we're sick is really incredibly important because, and many of you have probably heard this, is that we're trying to flatten the curve, right? And what that means is we're trying to stamp out the spread, right? We just want this to be a smoldering fire. We don't want this to be a wildfire. We just want a little bit of smoke. We're really trying to stamp this out. And the best way we can do that is social distancing and, self-isolation when people are sick. Obviously the hand washing and all of it. What we're seeing is that people who are going to spread this tend to be people who are going to have a very mild illness and probably don't even recognize that they've had it. And they're the ones that are going to be out, spreading this, right? And, generally in our population, it's like, well, it's not going to affect me. Is it a big deal? I'm just going to go on my trip. I've had a ton of people reaching out to me asking for advice. Should they cancel their trips? Should they, continue to, go to certain events? It's our social responsibility to follow the public health guidelines and do that aggressively. In Ontario, I'm in Saskatchewan, they haven't canceled schools yet. They have canceled the university. They have, as of yesterday, limited access to the hospitals. In Ontario, they have canceled schools. We shouldn't be waiting for the government to direct us. So I think in Saskatchewan, we are kind of in the thought of, well, it's not quite here yet. I can still live my daily life. And the best piece of advice that I saw on social media today was an infectious disease physician out of the States who basically said, pretend that you already have it. Pretend that you already have it and change your lifestyle based on that. Cancel your play dates. With schools being canceled, we don't want small kids still congregating at play dates. It doesn't mean you can't go outside. So people assume that social isolation is that you need to be in a bedroom with the door locked. You can go outside, get fresh air, play. You know, we want social distancing of about 2 to 3 meters. We don't want gatherings. If you have a hot vacation, I understand that there's a huge financial hit with canceling these trips. It's really important that you cancel it. We really don't want travel. This is being spread by travel. This is being spread by people who are well-meaning, who have gone to a conference and have been exposed and come back to their home province and now have exposed other people without realizing, right? Everybody is well-meaning, and so we really have to take this incredibly seriously. And so I urge you to cancel. The financial hit in the economy, we're all going to feel that. I have taken the social responsibility in my business that I will not be doing home visits because I can't risk being patient zero and spreading that to the most vulnerable populations. Will that affect my business? Absolutely. I am willing to do telehealth visits. It's really important that if you do get sick and you isolate, the other issue that I think that is going to arise is that we live in a society where we want certainty of a diagnosis. And so when we're sick, we want to go to the hospital or to a clinic or our family doctor or nurse practitioner's office and get a test to prove that that's what we had. Right now, we have in Saskatchewan, they're just opening up testing centers. Not every clinic or provider can test. You need a referral to go to those testing centers. It's important that if you have mild illness, that you are not bombarding the healthcare system searching for testing. It's important that depending on what province you live in, that you are calling the appropriate places to be screened to see if you need to be tested. The reason why we're doing testing now is because we haven't reached the threshold to understand the spread, but there will be a threshold in which we just stop testing people because we know that it's everywhere. And I say that because I experienced H1N1 in Nunavut in a very small community. And after we had done so many tests, it didn't matter. We knew that it was there in large volumes. And so you make the assumption that anybody that's coming in with these symptoms. Right now in Saskatoon, we need to do that testing to confirm those cases and to see what the spread pattern is. But I encourage you not to go to a clinic if you have mild symptoms, if you're having shortness of breath, if you're having chest pain, if you're having extreme fatigue, if you're unable to, keep down fluids and eat, you need to be accessing healthcare. You need to follow the guidelines of your province, which means in Saskatchewan, calling 811. They will direct you. Call, in some cases, call your family doctor's office for direction, call the emergency department. Do not just show up on doorsteps, okay? They need to be aware that you're on your way so they can put the proper things in place to make sure that you are safe, but also that the other people who haven't been exposed are safe. The other thing is hoarding supplies. Toilet paper has nothing to do with COVID, and neither do any other supplies. You do not need masks. You do not need gloves. You do not need excessive amounts of hand sanitizer. Soap and water is really what you need to be doing. Really good soap and water, washing your hands frequently, washing them long enough, over 20 seconds. You can see my video on the website or on the Facebook page or on Instagram about hand washing. This is important. As a person who didn't panic about getting supplies, now I'm kind of concerned because I have, I think, 6 rolls of toilet paper and I'm not sure where I'm going to get some. But I'm not worried about it. I'll figure it out. We have Kleenex. I can use a coffee filter if I need to, right? Or a face cloth, right? So really be careful because there are people who financially can't access excessive supplies, and we really need to be responsible, okay? make sure that you're checking in on people. So when we talk about social distancing and self-isolation, we still need connection. And I think this is how social media is really going to change in the next few weeks to months, is that this is the way we are going to be connecting. Whereas social media in the past has very much been very fake and disconnected. But we're going to be relying on this. Many physicians' offices, nurse practitioners are going to be doing more consults through telemedicine, including myself, to help decrease the anxiety, to help reassure people and help direct people so that they're accessing the care that they need. And this is going to be huge. So we do not want to forget about our neighbors. We do not want to forget about our loved ones. If you know of an elderly person who may need help getting groceries or supplies, getting that and putting them outside their front door. This stuff is really important. This is really going to shake up the world and change a lot of how we think and feel. And I think it's really going to change our society to not be so focused on consumerism and materialistic things, for us to be more connected with our neighbors. Like, how many of us know our neighbors? For us to get outside of ourselves and think about the greater good of the society and not just be out to protect me and my family. And so I am taking the approach of I'm pretending that I have it and changing my lifestyle accordingly. I am stopping going out for unnecessary places. So I'm not going to be working from coffee shops. I do have grocery shopping today. I will be doing that. But I'm not going to be going to browse the mall, right? I've canceled a play date with my daughter. No, there are not a lot of cases here in Saskatoon, but the thing is we need to be on top of this. And we need to be ahead of the curve. We need to learn from countries like Italy and Spain, who are absolutely drowning. Their healthcare system is collapsing because, and for Spain specifically, is that they didn't prepare and they ignored what was going on in Italy, which wasn't that far away. And so their rates are exponential. And so, when you think of, that exponential rate, that means there's exponentially a lot of people that are getting sick. So 10% of people who will get sick with coronavirus will need healthcare services at a hospital. And if you think in Spain it went overnight from 100 cases to 1,500 cases, 10%, that's huge. And so we really need to have social responsibility right now. What can you do to keep yourself, healthy? We also have to be getting good rest. We need to be managing our sleep. We need to be doing exercise. So get out and walk, get some sunshine. It'll make us feel better. Being cooped up in our homes will drive us crazy. Try to, use it as an opportunity to connect with your family, board games, movie nights, art, do those types of things, because it's going to feel incredibly uncomfortable being in a home, especially with young children, and trying to keep their attention span. It does not mean you can't go outside. Yeah. I think that's all I want to say for today. I will try to update people and be posting as accurate of information as I have. I am here if people need me, reach out. I've been answering a lot of questions. And we need to focus on managing our stress. And if you can work from home, work from home. So a lot of companies are doing that. My husband's company is basically saying, like, if you have the capacity to work from home, you should, right? Cancel unnecessary meetings, do them by virtual. Let's be socially responsible, okay? This is not just, let's not focus on me. Let's focus on everybody, okay? Love you guys. I will be in touch. Reach out if you need anything. Take care. Bye.